Welcome to the e-learning module on pathology of nutritional anemia. In this session, I'll be giving overview on the module. What are the objectives? Myself, Dr. Shruthi from Department of Pathology, KSED Medical Academy, Nitte deemed to be University. So what is anemia? Anemia is defined as reduced hemoglobin concentration in blood below the lower limit of normal range for that age and sex of the individual. There are many causes of anemia. Iron deficiency is one of the most prevalent form of malnutrition. So this accounts for around 50% of anemia worldwide, and it approximately it leads to around million deaths annually worldwide. Among all type of anemia, hypoproliferative anemias are the most common anemia. And in day-to-day practice, iron deficiency anemia is the most common of these, followed by anemia of inflammation. Whatever its cause, severe anemia leads to manifestation which is related to diminished hemoglobin, leading to decreased oxygen content in the blood. And on examination, patients appear pale and they report with weakness, easy fatigability, and dyspnea on mild exertion. So what are the consequences of anemia? Anemia can lead to reduced function and quality of life. It leads to decreased survival. There is increased chances of heart failure, and also there are increased risk of coronary artery disease related deaths. They present with the neurological functional deficit, and they often present with more complication related to surgery, and they show reduced tolerance to chemotherapy. So let us know what are the things which are covered in this module. So this module is on nutritional anemia and it is covered for undergraduate students in pathology. Total duration is 8 hours and it is covered in 7 sections. So each section has interactive instructor video, assessment and assignment, various graded and non-graded quiz, and reading material. So the section 1 is gives introduction to the module, and also briefly it introduces normal hematopoiesis and normal constituents of the bone marrow. Section 2 is on classification of anemia. Section 3 is on approach to diagnosis of anemia. Section 4 is on iron deficiency anemia. Section 5 gives differential diagnosis of microcytic hypochromic anemia. Section 6 gives megaloblastic anemia and its differential diagnosis. Section 7 is end module assessment with end module discussion forum, and say the e-learners are supposed to give the session feedback. So what are the objectives of this module? At the end of the module, students should be able to describe normal hematopoiesis and normal constituents of the bone marrow. They should be able to define and classify anemia and to describe the approach to laboratory diagnosis of anemia and describe etiology, investigations, and differential diagnosis of microcytic hypochromic anemia and also macrocytic anemia. Thank you.